So before we dive into the event, I just want to take a moment reflecting where we're at. We are more than 1 year into the global pandemic, and I'm sure the way we coordinate at our home office and balance your maybe childcare and online school or maintaining a personal well-being has never been so challenging. In the past 1 year, it is not a surprise that the healthcare industry took the center stage as we all worry about spread of a virus, concerned about medical supplies, and now we're all trying to get ourselves vaccinated. So the entire healthcare system has been under a stress test that's like never before. And all those experiences made us more appreciative of the frontline healthcare workers who keep us safe. So just before we start, I just want to take a moment to thank all of the doctors here, all of the medical practitioners here, and really, and I think we all owe you a big time. And I know all of you are really excited about the amazing lineup of speakers, and all the 3 doctors are fine example of technology and medical practitioners who want to do good in this world by leveraging their expertise and experiences. So before we start, I just want to quickly introduce the first speaker of today, Dr. Adeel Khan. I'm wondering, are you guys all struggling maintaining fitness during the lockdowns? I definitely do. Like, I feel like my friend keep on saying the only thing I gain is a 20 pounds. So, and I'm sure I'm not the only one here. And Dr. Adeel Khan is expert in essentially pain medicine and regenerative medicine, and also musculoskeletal medicine. His expertise really lies in the inventional orthopedics. So essentially using the orthobiologics to treat patient. What it means is essentially a technique of injecting stem cells and tissues to help patient recover from injuries related to like bones or muscles. And he has treated a wide range of star athletes, and including some of them being Olympic gold medalists. For those of you who are also into fitness, and I think you will find her story really interesting. Dr. Adeel Khan here also is quite an influencer on Instagram, share a lot of workout videos online and teaching people how to be safe, doing your workout. So make sure you check out her channel afterwards. And in addition to that, Dr. Adeel Khan is also a co-founder of Xalt, a fitness startup using data and machine learning to help solve health inequality by dividing measure and prescriptive exercise. And he's also Chief Scientific Officer at HD Muscle, helping to co-formulate high-quality science-based supplements. And Dr. Khan also teaches in 2 different universities. One is McMaster, the other was UFT. So welcome, Dr. Khan, to the stage.
Okay, yeah, thanks for having me. So kind of to talk about what, in terms of leveraging experiences and your expertise. So I was actually a personal trainer before I went into medicine. So I always saw this gap between the fitness world and between the medical world. And so that's what really got me into going into this startup company called Xalt. And Xalt, really our vision is to solve, fundamentally is to solve health inequality. Because if you think about it, the reason why people don't have access to health is actually access to high quality lifestyle medicine. So lifestyle medicine, we know, can prevent 80% of chronic diseases. And most diseases, heart disease, cancer, Alzheimer's, diabetes, these are the ones that really burden our society. And that's a big part of that is actually because of lifestyle. So that's really the whole idea behind Xalt, was to solve a lot of these health lifestyle issues and making personal training and making high quality lifestyle measures accessible to the masses. Do we have the slide, Jeremy, or the next one?
Yeah, we do have the slide.
Okay, perfect. Yeah. Okay, great. Yeah. So this is kind of the vision of what we want to do. So basically, this was a vision I kind of came up with, is solving inequality in fitness and health with an affordable platform for measured and prescriptive exercise. So fundamentally what that really means, the way I think about it, is in Canada, we have something called the Canada Health Act, and it's essentially about making physicians accessible to, or primary care physicians accessible to the masses. And so the way I looked at it is that, personal trainers should also be accessible to the masses. And the reason why it's not right now, as you guys probably know, getting a personal trainer at a gym costs, thousands of dollars and is not really accessible to the average person. In addition to that, the gap that between fitness and medicine that I saw was that the fitness world, even though there's a lot of high quality science out there about how to exercise and, in terms of lifestyle interventions, a lot of trainers aren't implementing those just because they don't have the right tool sets and right skill sets in implementing the latest science in helping people. So that was kind of what made us want to do measured and prescriptive exercise. And then we'll kind of talk about, the AI and data side of things as well. So if you kind of just go into the next, kind of picture, what we're trying to do, one of the biggest things is obviously about employee health and productivity, as well as absenteeism. All that gets influenced by how, healthy really is the employee, how healthy, and again, coming down to lifestyle medicine, right? And a lot of that isn't necessarily something a primary care physician is going to do. And quite frankly, most of them aren't really trained in that. They don't, in med school, we had maybe 2 lectures on nutrition, and it was essentially just the Canadian food guide. So unless you take it upon yourself to really become an expert in nutrition and health and fitness, there's a big gap in the medicine world for patients to really find, high quality resources. So we can go to the next slide about just, the main problem, which is really, the biggest thing is really that I want to emphasize is, health inequality, because that's really where the underlying fundamental problem that we're trying to solve. We want to make personal training and lifestyle medicine accessible to the masses. And the way we're actually doing that, one of the biggest ways we're doing that is having personal training at a fraction of the price as it would be if you went to the gym. And the reason we're able to do that is because we've come up with this virtual platform where you have 15-minute sessions. And there's been research showing that even just 11-minute sessions are actually enough. Like 11 minutes of quality exercise is enough to make a difference on health outcomes. And most people actually just need to move more. They don't need to necessarily go and work out for an hour in a high intensity environment. And I'm sure as everyone here can probably relate to, like, how many times have you tried to go to the gym and say, I'm going to work out for an hour a day, 5 times a week, and then how long do you actually stick to it? Or I'm sure, and everyone knows someone like that. And it kind of leads to the cyclical, dieting and cyclical, inability to really stick to a fitness regimen. And all that does is really disenfranchises people, because they just feel like this is impossible, this is too difficult. And so we're really focused on, movement and focusing on slow progress over time, and the concept of mastery, where you slowly get better at something over time. So we really want to develop long-term relationships. And if you look at it from our cost basis is around, you can get a personal trainer for a week, one time a week, for $1,000 a year. So we're hopefully, where a lot of people can hopefully afford that, as opposed to, getting a trainer for, $3,000 to $4,000 just for a couple months. And so, yeah, so the next slide is just kind of the solution is essentially a web-based platform, which there's two components that are really differentiating us from what is out there. So one is the mobility assessment. So we have our own mobility assessment that allows the trainers to assess, each joint and figure out prior to the session what they need to focus on or where their program should go. And this mobility assessment is actually we're actually going to be using camera technology that's going to be trained by one of our high level trainers, in terms of figuring out, okay, this person's range of motion compared to this side, there's an imbalance here, so they need to focus on this corrective exercise to fix this imbalance in order to prevent this problem in the future. And there's very little of that being done currently in the environment. So in the fitness world, like if you do Apple Fitness, if you do Peloton, you get this very generic delivery of fitness where it's just like one size fits all. And you can still even do Apple Fitness, and our platform can still be an adjunctive therapy to that, because there's no mobility component to Apple or to Peloton or to any of these other big corporate, generic delivery of fitness platforms. So we're really excited about that neural net component of training the AI from the camera technology. And then we also have the data component. So we're going to have the APIs of like MyFitnessPal, of Apple Watch, all integrated into our health dashboard. So it allows the client to upload all this data into our dashboard, and then we can keep track. Every session, we're keeping track of their diet, of their nutrition, of their sleep, of their stress levels. And this is all important because these are all considered fundamental pillars of health. If your sleep is off, or if you're stressed all the time, these things are going to, regardless of how much you work out, if these can negatively impact your health. So these are things that we're going to be tracking. And then, over time, as we have more data, we can make more specific recommendations on where to guide their training, as well as to guide their, lifestyle interventions. So that's kind of the gist of what we're doing in terms of the data and AI front. And, we have a really great team, and it's going to be a fun, fun project. We're officially launching in July, but we already have kind of proof of concept. We've been training people on the platform for several months, and we also have a scalable technology. I think those are the two important things you need for any company to really have is, a proof of concept and a scalable technology to really define if this is something that you can take to the next level. And that's kind of what we're hoping to do as we launch in July, where we have our own internal certification for personal trainers to do. And then being able to, and we have a lot of corporate clients who are already signed up with us. And so we're going to be able to deploy those trainers to those clients and then kind of go from there. So I think that was just, So I guess, it's supposed to be more of an interactive thing. So I guess if people want to ask questions or.
Yeah, so please, anyone want to ask question? I do have a question actually come from our social media. And a lot of people has asking, now we're all using this fitness app and when it will be the reality, we could connect our fitness app data with like a medical treatment plan. So I don't know, Dr. Ken, if you have any prediction here, and I know it's still in the future state.
So you mean medical treatment plan in terms of like being able to like take this to your GP and be like, oh, like we need
exactly.
Yeah. So I think that's actually coming up. I think that's right around the corner, to be honest. And that's actually what we want to provide. So what we're doing is if you go to your family doctor, they're going to do a blood test for your liver, for your kidney. They might do an ECG for your heart. So they're testing all these different organ systems, but there's nothing really being done for your musculoskeletal system. And and that's kind of what we're doing. We're actually measuring your musculoskeletal system and seeing, what the issues are with it, identifying it early on. And by looking at the musculoskeletal system as a complex organ system, that's not just for locomotor function, but it's actually, for longevity and health. That's something that they can take to their GP and be like, hey, look, I have these issues and I'm working with this trainer. Maybe I need to, and then it might change the GP's recommendation on like, other tests that they may order and that kind of thing. So ultimately we want this to be a tool that they can bring to their family doctors or family doctors will refer to us and, find this useful tool for their patients.
Awesome. I have Sarah here. I think raise a hand. Maybe you want to unmute yourself.
Awesome. Thank you. Hey, Adeel. This is really cool. I have like I don't know if it's a question that we can really answer, but I think we've been hearing this for so long. This idea that, like regular exercise is so great and, employee productivity and the strain on our healthcare systems. And I feel like a lot of the solution is we just try to encourage like more and more employers to offer like get $600 back if you sign up for a gym plan kind of idea. But as a population, we know that if people are active, they're in general healthier and it's less of a strain on our healthcare system. So like, where's policy on this? Where's our government? Like, why is this something that has to be paid out of pocket when the same people are saying that this is important for us to be healthy?
Well, unfortunately, lobbies and policies, a lot of it's it's the big bucks, right? Like big pharmaceutical companies and drug companies have a lot more lobby than just like lifestyle medicine interventions. I think it's just the medical community in general is definitely more biased towards drugs and surgery than towards, and that was our education in med school too, right? We had very little teaching on lifestyle medicine. And I think that's, you can incentivize behavior change by subsidizing memberships to the gym, by subsidizing, healthy food, because healthy food is more expensive than, cheap processed food at McDonald's or pizza, right? So there's all these issues. And, what you brought up too is about behavior change. Like everyone knows they need to exercise, but they can't stick to it. And so that's why in our program, we have, I don't know if you guys have heard of Pinduoduo in China. I'm sure you have, but yeah. So it's one of the fastest growing companies in the world. And the reason why they do it is they're doing gamification and they're doing a few other cool things. So we actually have gamification built into our dashboard. And on top of that, we also have our internal for certification for trainers. They actually learn about behavior change. So we're the only certification, as far as I know, in the world that has world experts who've designed a curriculum for trainers that teach them how to initiate and maintain behavior change and how to communicate that to clients. Because that's really where the value in terms of long-term results lies, right? It's not just doing a diet for a couple months and then coming off the wagon. And that's unfortunately the current standard in the fitness industry. Is just like do something for a few months and then good luck on your own, and like not actually learn how to maintain that on your own.
Yeah. Do you remember the Wii Fit when it came out with the the board? I used to remember that I loved it at first, but then it used to make me feel so guilty because you'd sign in and it'd be like, "Hi, Sarah, we haven't seen you for 47 days." And I'm like, I'm not coming back if you're going to talk to me in that tone. It goes both ways.
Exactly. There's a right way and a wrong way to do it. So
Amazing.
Awesome. Thanks, Adeel.
Let's move on to the next question. And I know there was a question related to motivation. I feel like Dr. Ken really kind of answered that. So I'm going to move on to the next question. Thank you, Professor of Entrepreneurship. How is mental health connected to this app? Does good mental health improve outcomes? And a second question from him, how are you building a neural network to tangibly improve outcomes? And I feel like it's a loaded question, but go ahead.
Yeah, sorry, what was the first question? I'm not thinking about the neural question.
Yeah, so the first question is healthcare.
Yeah, sorry, so yes, the mental health. Yeah, every session, the trainer actually asks the client, rate your stress levels and your mental and your mood for the last, since we last met. And they ask them to rate it on a scale of like 1 to 10. And then that way they actually have a quantitative way to track this. And then based off that, we can also track, how was their performance in the workout? How was their, and other health measures over time, right? So this is something we can have with this data that we can track over time to see how it affects, potentially if we need to change your exercise prescription, if they're super stressed out and they're very, they're depressed, maybe instead of doing a high intensity program, they need to do a low intensity program. And so this is something that we're going to be able to change over time as we get more data. And right now, exercise prescription is so limited because there's so little data out there. There's some studies with a few thousand patients here and there, but we're going to be able to have over time, as we grow this platform, we're going to be able to have millions of data points. And that's kind of the idea behind. And that as you get more data, you get more valuable data that allows you to infer those health outcomes and figure out what kind of exercise to prescribe. And then in addition to that, the neural net. So what was he asking exactly about the neural net?
So I think you're just asking, are you using neural net to tangibly improve outcome? So
yeah, so how are we going to tangibly improve it is by the mobility assessment, by saying, okay, this is a corrective exercise that you need to do to help, hopefully prevent an injury. So there's something called functional movement screen, for example, that's been shown to, somewhat predict injury risk, but it's maybe like 50% accurate. So what we're going to have is we have like a world expert in terms of like biomechanics and training the neural net to figure out, okay, this is the right way to do this movement pattern. So when you're doing a squat, say if the camera technology watches them do the squat and it watches them, their knees go too forward or their knees cave in, but it doesn't pick up on that, then the trainer who's training the neural net can say, okay, this is the data that needs to be inputted to change how the neural net is picking up the assessment part. So it's just like any neural net, right? It's just basically, it's kind of like, it's almost like brute force, right? You got to tell it what it needs to know and then over time it learns this is what it needs to focus on.
Got it. Thank you. I know we still have a lot of questions. If you don't mind, hold back and just we're gonna have a designated Q&A in the end of the events, and we need to move on to the next speaker. So if I can get the slide up. So the next speaker, thank you, Adeel. This has been wonderful. We will make sure to get you back. So we want to ask you more questions. Okay, so our next speaker, you can get on the stage, is Dr. Kashif Pizzada. Dr. Pirzada is a fun example of frontline healthcare workers. And he works as an emergency physician in Toronto. And he's also a co-founder of two amazing non-for-profit. One is called Conquer COVID-19, and the other one's called Mask for Canada. Both groups, they help fight the pandemic and make life safer for healthcare workers and the public. And he's also a startup founder working on Raven, a social media news aggregator application to help you break your social media bubble. So welcome Kashif to the stage. And before maybe you start, I just really want to share the story. When we first time talked to Dr. Pirzada here, and we just really, it took us some time to actually get him to agree on speaking on this panel. And initially, we were just curious about how he started this COVID initiative. And he told us he started from a simple WhatsApp group and literally started with 4 or 5 people and quickly snowballed to hundreds of volunteers. And some of them being celebrity, politician, company CEOs, some of them are just ordinary citizens who wanted to help. And during the time, if we all remember back in April last year, when masks and other medical supplies were still scarce. And he and his team arranged, and I remember an entire Bombardier airplane to transport those medical supplies to Canada. And one thing, it just really stuck to me. Dr. Kashif here told me no one in his two group really wanted to be self-identified because they really just want to help others. So I just really think, it is such a wonderful story, and I cannot wait to hear more from you. And I just want to also feel honored to have you join us today. And one of the key ingredients of Innovate by Design, it is about providing a platform for those human story and doing good for others. And I feel like this is just such a fine example. So Dr. Pirzada, and please go ahead, and I know you have a presentation prepared.
Thank you so much, and you're very kind. Thank you, thank you. So I'm just going to share my my slides here. Can you guys see my screen? Okay. So I'm basically going to talk about how bringing a startup mentality to probably the greatest health crisis we're ever going to see, hopefully. I'm an emergency physician and a faculty member at McMaster University. And first of all, I want to say go Leafs later today. I hope everyone watches. Anyways, basically my career has been pretty uneventful. I went to U of T for med school and then McGill for my residency. I did some volunteer work in international aid abroad, and have been working, picking up jobs like working as a coroner. And I got into the startup world about 5 years ago with a fitness startup that failed miserably. I'm glad Dr. Khan is working on an app that looks really promising. And then, life was going pretty smoothly until we started getting the news out of China. This is a WhatsApp message I sent to a friend who was passing through China on his way back to his home in Singapore. And I didn't know at the time, he didn't know at the time what this meant, but this was January 3rd, when just a few days after the Chinese authorities finally realized what was happening. And for me, I started watching a lot of Chinese media. My app that I was working on, Raven, which hopefully will be out soon, indexes news sources from all over the world. And I was seeing a lot of translated, really, really concerning posts from China. And then I picked up videos on their social media and videos posted on YouTube by brave Chinese citizens. And I just felt that, there was no alarm here about that thing. And for me, I went through SARS as a medical student. This is my 3rd year of medical school. SARS was an outbreak that was contained within the hospitals, but half of my medical class was exposed, including me, and I was quarantined at that time. And the memories leave a scar at that time. We were all traumatized by it. And then when we saw that there wasn't that much concern about what was happening in China, it sort of made me really wonder what was happening. And I saw, fast forward 17 years later, I saw probably Canada's 3rd case of COVID-19 in January in the Emerge. And so, you talk to the experts, this is the message we got from people, nothing to worry about, everything's fine. You just go on with your lives. Everything's a low risk. But, you know, after going through what happened in 2003 and then seeing what was happening in China, that obviously wasn't the case. And the thing is, you look at who got it right. It wasn't your typical people, right? You had Silicon Valley venture capitalists, you know, Zeynep Tufekci, sociologist, an AI researcher in San Francisco who started the mask movement. They got it right, and then the people who should have got it right didn't. So you had sort of a failure of multiple academic disciplines, the virologists, the infection control people, to really comprehend what was happening. And in those cases, what do you do when you see the world falling apart in front of your eyes and the people who should be doing things to stop it aren't doing it? So really the task falls on you to act. You know, you might not think that you have the power to do it, but the tools are there. And this is what myself and many of the colleagues I grew to work with saw. Basically, you have to get organized. You discuss with your friends, start prepping with your family, make tutorial videos. This is an early training session we did in January when we first saw the few cases in Canada. We got everyone trained up and prepared to see coronavirus cases. Organize online, make your workplace safe. This is my Costco run right after I saw that case. I bought $2,000 worth of food that I stored away. Maybe it was a bit too much. I still have it actually. Plan to protect yourself and your family. Call everyone. Pull every thread that you can, every connection. In that time in March, like you were mentioning before, you could get any CEO on the phone and they wouldn't ask, you know, what's in it for my company. They said, what can we do to help? Every auto company, every industrial company, every engineering company came forward to help. And they didn't ask for any credit. A lot of companies threw a lot of money into production of ventilators and masks, and they're still not asking for credit for that. And then the most important thing is get to work. Still, you know, even no matter what you do, the Titanic could still head for the iceberg, but you still have to keep working at it. What can you do? Start a grassroots group and campaign, start a nonprofit, lobby the government directly, lobby industries directly, even creating a large Facebook group, which a lot of physicians did at the start of the pandemic. And that group was a source of coordinating actions across the country. Never assume those in power know what they're doing. That's something the pandemic's taught us. Remember, also, peacetime, people in charge in peacetime may not be good in a crisis. And that's something we've seen in the world wars, in the US Civil War. People who are used to a very predictable career may not know what to do when things fall apart. One thing I've discovered in government is that there's a big lack of science and technology literacy in the top echelons. Most of our leaders come from legal, teaching, or similar backgrounds. The government doesn't know what to do with software. They have no capacity to develop it. That was pretty obvious when we tried to pitch contact tracing software to them. And that's something that needs to change. You know, when you're organizing, don't do anything alone. Get people with you. Like we mentioned, like everything grew out of WhatsApp groups. We just added people until we had the capability to do what we needed to do. And a small team with the right motives and skill set can change the world. I had a chaotic time because we were expecting a newborn who came right when the crisis hit. So I had zero time. I had to collaborate with hundreds of people across the country to get anything done. And everyone, and you have to really shift what I call the zeitgeist, the spirit of the times. And it's a stubborn thing. Society is a very stubborn thing to move. There's a lot of inertia for good reason. You know, radical change is a difficult thing to do. But you know, closing the U.S. border was an unthinkable action back in February, but it happened, and it saved us from an even worse outbreak. So gradually, it takes time and effort to move. And it takes a lot of effort and education and persistence, but eventually you can move the ship, and then ultimately you reach a tipping point when everything aligns in your favor. And then you can get change done. That's where the media agrees with what you're doing, politicians see the merit in your arguments, and the people are with you. I'll bring you, I'm just gonna go over general principles. This is a kind of a framework I came up with the way we started these groups, was that identify a problem, invite a team, and then use all the modern tools like Slack. Slack gave everyone free access for anyone working on COVID stuff. Zoom, like we're using right now, G Suite, Notion, Discord, amazing tools that are free to use for lots of teams. come up with a plan and try to implement it, build an MVP. In the case of Conquer COVID, it was build an engine to take in requests for PPE and then find a way to distribute it with your volunteers across the country. Evaluate and then pivot when an idea doesn't work. That's your basic startup mentality. I really like to credit Startup School by Y Combinator. I was floundering in the first startup that I created because I didn't know the basics, but this is a great set of programs if you guys want to dip your toes into that world. And these are other principles more applying to nonprofits is that, really take yourself out of the equation. Check your ego. This is not the kind of work that's going to make you a billionaire. Unlikely that even if government adopts what you're doing, you'll probably not even get credit for any of it, which is fine. It's the cause that's important. And if I have to look back at any of the colleagues I work with, no one wants to take credit. No one wants an award. We just want lives to be saved and for the country to get better quickly. The other thing is move fast and get things done. Mobilize your community. And like I mentioned before, don't be the story, avoid the limelight. I like to, this is Dr. John Evans. He was a president of the University of Toronto decades ago, and he also founded McMaster University's Faculty of Medicine. And he had a range of principles which I like to adopt with any team that I work with, which is, really capture the skills and interests of the people you have, and then give them the freedom to act on them. Provide resources, give a high degree of autonomy, and provide subtle forms of guidance, and then stand back and watch the achievements pile up. And that's what I've seen with all the teams that I've worked with on every project. I'll give you a case study for Masks for Canada. So in the summer 2020, the polls were showing, and we had a pollster on our side helping us with some of these numbers, that more than 80% of Canadians were in favor of masking to protect themselves and others. And there's almost no issue where 80% of the population agrees to anything. And yet, even though the evidence from SARS and from flu showed that masks were effective, we still had trouble getting politicians and public health officials to act on this. And they were bogged down in endless arguments about the best evidence. This is an email I got back from a public health officer, giving various reasons why it wasn't possible to get mask laws. Eventually, we had to go around them. We all met on Twitter, we organized on WhatsApp, and eventually we got thousands of physicians to agree, write an open letter, and went around them to public health. We held 300 media interviews. We managed to convert one city on our side. And then from there was a snowball, and we got mask mandates passed across the country. And hopefully they'll stay in place as we reopen until we have enough people vaccinated. So that's one case study. And we went on to trying to work on making schools safe, which is an ongoing thing. We've tracked school cases across the country, we pushed for rapid tests, zero COVID, which no one's adopted yet. And the other important thing is we really pushed hard for airborne spread awareness, that COVID, like its cousin SARS-1, is an airborne virus. And it's been recognized, but the protections to implement it still aren't being put in because the admission from the CDC and WHO only came a few weeks ago. So you can do a lot of good. So I'm glad to say, cooperate and work together with your fellow citizens. Be kind and help wherever you can. Stand on the shoulders of others, and but check your ego and work collaboratively wherever you can. And talk less, listen more. Everyone has a lot to say, but really try to take the knowledge from other people. Keep an eye out on the major crises that are going to come in the future. I think they can all be tackled with a similar approach, with citizen advocacy and with application of proper knowledge and organization at the right time. Thank you so much. Look forward to the questions, and thank you so much for inviting me to speak.
Thank you, Dr. Kashif here. Yes, please, if you guys have any question, please raise your hands or type out in the chat. Otherwise, I have a lot of questions, so. Okay, I'm gonna pull some questions actually from our YouTube channel. Just take a quick look here. So what's the most challenging time actually in the past 1 year?
I think it was returning to work after after we had the baby, was going into a situation where we weren't sure what equipment we had and how contagious this virus was. So that was a risk. Like basically, you know, I was really afraid of having to bring home the virus with and possibly endanger the newborn and stuff. So
Right.
with vaccination, you know, those fears are a lot less. Like I'm not as worried about harming kids, but that was the hardest thing throughout the entire year. And I think it's still an open question whether vaccination will protect from transmitting to kids. So my heart will be at ease when children get vaccinated this fall. I think September, October, hopefully.
Makes sense. So, you know, after 1 year's trial and error, and I know this is an unprecedented time, do you think, you know, as a country, and then maybe even look at globally, do you think are we ready for another pandemic? Because I feel like everybody is going through so much right now and thinking about are we being safe? Is the next time something like that happens?
We're ready for this pandemic. The next one, who knows? Like the nightmare would be something like Ebola, which is much more deadly and contagious. I think, you know, some of the principles from this pandemic should apply. Like, you know, next time we hear about a virus happening somewhere across the world, you know, we should shut down travel quickly, isolate it to that region. Because, you know, like, you know, January 3rd is when we got the alert. If we had isolated everything into China, China probably could have squelched it within a month or so, like they did. And maybe it wouldn't have spread outside. So lessons like that, like implementing treatments faster, rapid tests faster. I think there's a lot of lessons that we can bring. I think, you know, there needs to be real reform of the WHO, especially the way they handled the pandemic early on. It clearly is a flawed body that acted too slowly, especially currently on the issue of airborne transmission. It took them a year to recognize what was obvious from the beginning.
Sense. Were you able to mobilize policymakers since you have this firsthand knowledge? And have you seen any, you know, just like, you know, how we collaborate with the private sector, and then is there any push maybe just for maybe strengthening the healthcare systems, making more equitable access to others?
There's definitely been an effort to beef up resources in an emergency, but I don't see if they're doing anything long-term to handle things. The thing with politicians that I've learned is that it's like trying to engage with a 3-year-old. The memory is short, and the attention span isn't there really. It's like you have to get, it has to align with their interests and with which their interest is getting elected. And does your idea work with that? Really, I think the only thing that's worked has been overwhelming public pressure that you can try to corral with the media, hopefully.
Makes sense. I saw there's a couple comments related to government's public policies. I'm just wondering if JP Lambs and also Nabil Khan would like to maybe unmute yourself and then just ask the question directly. You know, I'm gonna call on you, right?
Okay, so hey, can you hear me?
Yes, I can hear you.
Okay, perfect. Yeah, hey, Kashif, how are you doing? I was just going to quickly ask, you know, Ontario released its framework. I know it's probably more of a political question, but they just released their framework today. What did you think about it? It seems like they're doing some stuff correctly, but some stuff is like a mixed bag.
I think it looks good. I think the strength is that the single dose vaccine seems really, really effective so far, except for people with immunocompromise or above 70 or so. So I think the threshold where they open things up, where 75% have 1 dose and 25% have 2 doses, is not a bad idea. I'm really suspicious of them opening up large-scale indoor events, and I'd like them to consider hospital capacity if that happens. One thing I would really be opposed to is removing the mask requirements indoors until children are vaccinated. Because we're seeing in Singapore in their outbreak right now is that vaccinated people are transmitting to unvaccinated family members. So what will happen is that once we reach a certain threshold, and it looks like 90% of Canadians want the vaccine, that'll effectively crush COVID transmission, hopefully. So, and then maybe we'll be in a much better place in a few months, hopefully.
Awesome. We're going to come back to Dr. Kashif Pizzada afterwards. But now let's just quickly move on to the next slide, if you don't mind. We often, thank you. We often say it is it's the humans who really make the story compelling. So at Innovate by Design, we also want to feature tech-enabled millennials who break norms and build dreams. So if we have launched a series of storytelling mediums online. So if you can flip on the next page, just a quick kind of shout out. I'm gonna wait for the next slide. Hey, so if you like to follow us, and we have a couple platforms available for you. One is our podcast. So if you search Think with ABD or Analytic by Design, you will be able to listen to similar talk. And we also have a YouTube channel available. So all this recording will be available there as well. Okay, so we might want to moving on to the next talk. I'm really excited because the next talk will be a little bit different, and I don't think we're going to take a break. Sorry. Okay, so the next speaker I would like to introduce is Dr. Amrit, Sehdev, CEO of a Carekore, also a medical director of a panel physician for Government of Canada. Dr. Sehdev has a long history of working in the intersections of data science and healthcare, receiving rewards such as Mid-Tax and one of the Canadian Premier Innovation Awards. And also he is a TELUS Health Accelerator in the most recent role as a medical director at a panel physician for Government of Canada. Dr. Sehdev advised on equitable public health care access and anti-discriminatory act towards visible minorities during the COVID-19 vaccine rollout. So welcome, Doctor, to the stage. And I know I also want to introduce Sarah Sam will be the moderator for the fireside chat, and we're going to changing out a little bit. We're not going to do a presentation. We'll have be able to ask questions directly. So Sarah Sam.
Hi guys, sorry for that delay. As apparently I'm not allowed to unmute myself. Michelle knows how much I can talk. Amrit, I'm so excited to do this with you.
Hey, Sarah.
We have had some fantastic conversations, and I have this really long list of things. We'll see if we can get through all of them. But right. I want to jump with one of the things that is sort of top of mind for me and my friends and my family, and let's talk about vaccines. Has there been a more divisive topic in like living memory? Like I've seen, it's like vaccine seems to be ripping apart families and friends, and like, yeah, it's crazy.
You know, I want to say before going to it, like so I just kind of met Dr. Pirzada just when we started, and I know he's going to have a lot to add to this because the work he's done with Conquer COVID and you know, working the merge, he's going to be a bona fide area of like information for us. So I think we should tap on him when we, you know, get stuck, if that's okay with him.
Yeah.
But, you're absolutely right. You know, I mean, the reality is that we have had a lot of vaccine hesitancy very early on when, you know, vaccinations started to come out, and they kind of continue. What I'm interested in is, you know, in the US, there's been a political change in the views around vaccine and science, and we'll leave it at that. And what I'm curious about is, you know, some of the characters that are pushing that vaccine hesitancy, is that going to drop? Is that going to change as politics now change as well? Or is the vaccine hesitancy something much deeper than just politics or character of politics and image and all that stuff? I think what we initially thought was that we would see vaccine hesitancy around certain education levels, certain income levels, particularly people who may be more disadvantaged. But I don't think that's the case. I don't think we're seeing that, you know, minorities are the ones that are hesitant to getting vaccines. I think vaccine hesitancy is everywhere, despite your race, your education, or your income. So super divisive topic. Families are fighting over it. Very luckily for me, my entire family, extended family involved, are the ones that are making sure everyone's, getting vaccinated. When can we get vaccinated, and all that kind of stuff. And so we've been pretty safe. But when I think about my practice, it's actually the younger crowd, the people in their like 20s, who are very, very hesitant and maybe a bit mistrusting of the evidence or research or what's going on there.
That's funny. In my world, it's like, like the crazy aunt with
the crazy aunt,
yeah,
right?
or crazy aunt or uncle, right?
Yeah.
But like, so you said that like the vaccine hesitancy, you're seeing it kind of cross cultural and like income boundaries, but COVID itself isn't, right? You sent me some fascinating I'm going to read this for our audience.
Yeah.
This is all public on the City of Toronto's website. This is data as of March 31st from the city. The overall percent of reported cases who are racialized remains similar to previous months at 74%. That means it's like racialized groups are literally 3 times as more likely to have gotten COVID in the GTA.
So
what's going on here?
And I want to pick on that for a second, because that does not necessarily mean that racialized groups are hesitant on getting vaccines.
Mm-hmm.
That might mean that access is an issue.
Interesting. Very interesting.
So this is a very important distinction, right? Because in let's pick on Peel, because we can safely pick on Peel, because I'm a representation of work that's being done there. Peel region has been historically missing very, very significant health resources to deal with their population, with their health problems, and so forth, right? And that was one of the key regions that should have had higher testing sites and better vaccination sites from the beginning, right? Not 6 months out, 8 months out, not at that point, right? And so what we're seeing is not just a combination of a lack of resources, but also a reality of their jobs, their lives, and all that, right? Because we know that most of the warehouses where we get our Amazon deliveries from are in Peel region. Most of the transportation services, food delivery services are in the Peel region. And I think people don't really understand how big these warehouses are and how many people it takes to run these warehouses, right? So you're in closed environments, you're with people that come from multi-generational households, and who live with grandparents who, are in that age bracket where they're very susceptible to getting sick, and then very sick from COVID.
How come I don't see anything in the news about this? At the most, I'll see someone say like low income. Is it because they're afraid of talking about ethnicity and the cross section?
So I think it's fair to first say that, like, when you and I talk, and we should let people know that we talk openly, right? So we're not trying to hold punches. We're going to say what we think, and some people might agree, some people not, but hopefully we're all mature enough to kind of disagree respectfully with each other. So your question was, how come I'm not seeing this in the news? And then you kind of asked, is it because, is money not a big part of this? I think it's a lot of reasons. I think, first of all, when you look at the news cycle, there were so many things happening this past year. And what you're dealing with is an issue that doesn't go away in one news cycle. It's an issue that's generational, right? So I'm not sure if you've heard of social. I know, Sarah, you know what social determinants are, but for people who don't know what social determinants are a set of variables that we can use to assess how well one might be doing in their life. And this comes down to their education, their literacy level, their income level, their access to transportation, their social supports, mental health, and so forth. People who have maybe a lower score on this metric, it's really because of what's happening before they're even born. You know what I mean? So one of the reasons why I think it's not in the news every day or all the time is because it's an issue that's really not going to go away. And how many times is CBC going to run an article on, you know, but I think what's very powerful is like some of the work that Dr. Pirzada was doing, I think really touched on, some of those issues, disparities, inequities, inequalities, right? Some of the work that we're doing with the South Asian COVID Task Force really was about, well, hold on, right? Like back in December, why were the rates of COVID so much higher in areas where it was more diverse?
Mhm.
Why, right? And if we knew the answer, why wasn't anything being done? And I'm not picking on Dr. Pirzada. I just think he's such a great guy to be in this conversation. He works at Brampton Civic. Brampton Civic Hospital is a very busy hospital, right? And it must have been crazy working there when, back in December, January, when things were just really popping off, like scary.
Yeah.
Scary.
Yeah.
And so the work that we've been doing has really been to understand first, why do these inequities exist? And much to his point about those slides of how you kind of get noise, gather momentum, and make changes, how do we start making those changes? And this is everything that he said. It's getting politicians involved, grassroots movements. It took quite some time for the people from social media to get involved and getting them involved, but they started to see the light as well, that this is really important. And through that, we were able to set up additional testing sites, quarantine sites. Quarantine sites were a big deal because once you have COVID, where do you go if you have no money? Say you can't afford a hotel, you can't afford an Airbnb. What are you going to do? And that's the majority of Canadians. They fall in this situation where, are they choosing between rent and food or going to work sick? So quarantine sites were a really big deal to set up in the Peel region because that provided the safe house for them. And then, of course, now we're at the vaccination sites. And so, we're help setting up vaccine sites in Brampton as we speak.
Okay. This is just so fascinating. And I can't help but think that it's like, there's some such interesting dynamics and news that could be here. And instead, I get so annoyed because every day it's just like, shut all the borders, shut all the roads, stop leaving. And I'm like, great. Can we talk about, like, we've heard that spiel so often. Can we talk about the other things?
It's interesting because, again, I think Kashif, Dr. Pizzada had a slide up that talked about the social kind of, not disaster, challenges that are to come, right? He had stuff about like the next pandemic, and at the bottom he was talking about social inequalities, right? He was talking about some of the power imbalances that have been heightened from COVID, that are certainly going to be an even bigger deal in the next 5 years, right?
Yeah, for sure.
What COVID has done from a income imbalance perspective is it's highlighted people who have and those that don't have. And we've seen property prices, obviously everybody knows this, is like bananas here, right? And so what's going to happen to people who are, to the stats that you read that were 3 times higher? What's going to happen to that group? And then I think the bigger question is, I'm kind of trying to phrase this the right way, why should we care? Right? Like, that's a question that I think nobody really wants to ask because we're so concerned about what's going on in our lives, but why should we care about what's happening to other people? Right? And Sarah, because I asked that question, I think I'm going to let you try to answer that one first.
Oh my goodness.
Yeah.
I don't know. I think, why should we care? Well, that's a tough one. I mean, I'm going to draw, so from like a personal experience perspective, having grown up as, second generation Canadian, my parents are refugees here, and we should care because there's so much potential in those. Like we're not doing Canada a favor if we don't unlock the potential in every single one of our citizens. And if you're being held down because you can't, because like mom and dad are working 3 jobs to pay the bills, you're like, how can we thrive as a society when the vast majority of our population can't thrive?
I love that. I love that you started with that kind of answer, because I was thinking about this the other day. and this is my brother's line. I'm stealing my brother's line because he got asked this, and it's, you know, how do you define being Canadian? We all look different.
Yeah.
Right? Our parents all come from different parts of the world. How do you define Canadian? And it's something so Canadian to care about another person. There's something that's
True.
inherently in us where if we see our neighbors, you know, hurting, we're going to do something to help. And much to, again, what Kashif said, you're not looking for credit. You're not looking for, you know, your names to be, you know, in the bright lights. It's just something that, you know, you should be doing. But even further to your point is unlocking potential. You know, if we're this big company, if Canada is this massive company, how are we going to move into that, you know, the top echelon of countries in the world, like, you know, the economic powerhouses in the world, if we're not unlocking potential, you know, because we're all children of immigrants, every single one of us here. Right. And I would say that we all feel that we're unlocking some, maybe not all of our potential, but some of our potential. And the next generation is going to be even better than us.
Yeah, I agree. Hold that thought. We're going to come back to it. Apparently, we're supposed to talk about the future of healthcare.
Oh, right.
So,
okay.
Well, first of all, like, what can we learn from COVID? Like, what do you see? What have you read? What are the lessons that are coming out of this right now?
I mean, so for Canada alone, or what do you?
Let's talk Canada. This is our home turf. We know this.
You know,
this
again, I think Dr. Pirzada talked about some of the, you know, the lessons learned of a faster response time, right? So isolation, protection, PPE, right? Very, very critical things. There was PPE shortage. You know, from big picture things, we need better logistics, supply chains that need to be foolproof. And part of that, of course, is producing our own vaccines, which the federal government is making big moves on, right? They're building plants across Canada. I think they just announced a couple of $100 million plant in Mississauga. I want to say 200 million. I don't really remember, just last week. So we need to stop relying on other countries to get our vaccines and then relying on supply chains to get them into Canada, because there was a period just about a month ago where we weren't getting any vaccines in. Right. And just this past month, we got a boatload. We got like millions and millions of vaccines. Right. So that was the first thing. I think the second thing is also the communication between the federal government and the provincial government needs to be much, much more clear, much more concise. Right.
Such a disaster.
Right. Such a disaster. Right. So, you know, we all know of Trudeau and Ford's arguments around keeping borders open, keeping borders closed, what are we doing, yada, yada. But, you know, I don't know if people know that the federal government had bought vaccines from Eli Lilly and approved them for use. And then the BC government or the BC task force said, no, we don't want to use them. So I'm not sure if people know about that. Another big, you know, example would be nursing homes. I think the statistic is, hopefully someone can correct me, I think it's 60 or 70% of all mortality in Canada from COVID happened in nursing homes. It's a scary number.
It's terrifying.
Scary, scary number. So where does the leadership around that now turn to? You know? So I think the communication between the federal, provincial government is better. We talked about logistics. We talked about supply chains. I think the other aspect is that the communication on a more grassroots level. So, you know, we're going from federal, provincial, now let's go to municipal. The public health response on how to engage people needs to be streamlined. That was probably one of the biggest and easiest changes that we could have made, which was producing culturally responsive and proper public health messaging so that people were educated from the get-go.
Yeah.
You know, so it's a combination of all these things. Some things cost a lot of money, like producing vaccination plans. Some things don't cost a lot of money, like getting better communication.
Yeah.
The question is, what would be more successful to even prevent us from having a massive outbreak? Probably the cheaper option, which is that getting your cards in line, which is better communication across the board. So
from like a communications perspective, And people love to talk about how like COVID has really pushed forward digitization, et cetera. And yet I still see statistics like this, which is like 7% of healthcare and pharmaceutical companies have said that they have gone digital. 7%. And I remember like the shock on my face when my doctor, instead of giving me a handwritten prescription, he like printed it. Or the day when they like were able to fax it to my pharmacist. I like part of it I think is our fault. Like we got so complacent. I'm like, at the same time that I think that is innovation, we have self-driving cars. Like
yeah, it's very interesting. That's such a good contrast that we have self-driving cars, but some doctors are still writing, paper prescriptions.
Right?
Yeah.
And so there's a struggle where we talk about this, like we can't, communications is like such a struggle, but I can't even see like digitization in the medical industry is a struggle. And then I'm like, if we're bringing all these people and things online, I have so many questions like the cybersecurity aspect. Do we have enough professionals that can protect all that data? What's happening in that space? Vaughan just opened up down the street from me. There's like a new smart hospital. I'm super curious like what that means, but I'm like, does that mean you have like the world's biggest IT team as well to like handle this? Yeah. I'm curious.
Okay, let's unpack that for a second. I think what you're really asking about is disruption. Yeah. Right? You're really asking about when is healthcare going to be disrupted on a digital level, right? And again, to the audience, please chime in here because I don't think there's a right answer here, but I think you need a lot of things to go right for a massive disruption at that level. You know what I mean? Like you need a lot of things. Absolutely, COVID is an ingredient that's going to lead to healthcare disruption, right? The most obvious example is telemedicine, right? The Xalt stock went from, I don't know, it's worth like $10,000 now or something. I don't know. But my point is, you needed something like that to push old technology forward because telemedicine it's not new technology.
No, it's not.
In fact, there's nothing really new about any of the telemedicine options that have come out during the pandemic. The only thing that really changed, I think, from a doctor's side is that we accepted it as a means to communicate with patients. So then that's another ingredient is that the stakeholders need to accept change, right? So
that's a tough one.
It's a tough one.
The stakeholders need, yeah, you're right.
So you need them to feel that they have to accept it.
Yeah.
You have to remove the barriers for them to accept it. So what did the government do? They started allowing doctors to bill for telemedicine, right? Not immediately, by the way. That came months after COVID.
You're kidding me.
But so now doctors have the ability to bill for their time. Excellent, right? So then, maybe to Dr. Khan's point about digitizing functional rehab and pain, like there's then other stakeholders like himself who come up with great ideas of now pushing that ball up the hill, right? So now you have COVID, now you have stakeholders willing to accept change, and then you have stakeholders willing to drive change. But at the other side of this is the patients who are the customers, who are the clients, and who are the people that are going to be using this. And it really comes down to you guys is, do you demand change?
When we demand change, and then there's another article being like, healthcare is being transformed by millennials. How disgusting. Or like, millennials don't like doctors anymore. Like it's
millennials adding crazy. Avocado to their, diet plan.
Right? Gen Z doesn't get, it's anyways. I have an issue with sensational media in case you can't tell.
But in my humble opinion, I don't think it's the millennials or Gen Z who are going to drive or demand change.
It's not.
It's going to be our baby boomers.
Exactly. They also hold all the wealth right now.
That's why, right? So let's go back to something I was saying before, which was nursing homes. So I think it's obvious to say that there's a lack of trust in nursing homes now. Right? As our baby boomers age, where are they going to want to age?
According to the boomers in my life, anywhere but a nursing home.
Anywhere but a nursing home. And let's add another element to this. What's going on with housing prices? Can millennials step in and buy the baby boomers' homes? Absolutely not. Okay, so now
1.7
we have,
mini for a semi-detached in the GTA.
right? I mean,
right?
what's
Like,
going on? So now you have the same kind of perfect storm happening for disruption for aging at home, because you have the majority of our population who hold wealth unable to transfer that wealth into real dollars because it's stuck in their homes because nobody buy their homes. And you're going to have to create, innovation to provide that level of care that they need. Plus, they can afford it, right? And I think that's going to be a massive trend coming into the next 10 years, which is the digitization of aging at home. And that brings up a whole other topic of, wearables, point check care. So getting a blood pressure machine at home that, sends the information off to your doctor, who can in real time discuss what's going on with you, your sugar levels, all that kind of stuff.
okay, so you're CEO of Carekore, and the business revolves around such fascinating like data collection, preventative healthcare. For those of you who've not seen it, definitely check it out. You are a CEO of that. You're also seeing just like immense need in the streets, etc. How are you balancing the need that people should have access to these kind of things, almost as like a basic human right, and the fact that you have a business to run and bills to pay?
Oh, Lord. I think every
Getting real
doctor's
here.
worst nightmare to be asked, which is,
I'm sorry.
how do you are you commodity, are you putting a price to health? And I think I'm going to be very, honest and transparent here. I am part of a team. Okay. I might have the label of CEO, but I certainly never feel like a CEO at any given day. Okay. Like I'm the one that's, I'm often getting into arguments with my board, or, talking to whoever, trying to figure out what's going on. I'm always lost. But I always approach every day of, how am I going to add value here as a domain expert, right? Mm-hmm. And a lot of my background comes obviously from identifying inequities and dealing with inequities. And I have a opposite and brilliant, people on the board who challenge me to say, well, okay, we see where you're coming from, but how are we going to pay the bills? Because, already in Toronto, we have a team of about 30 people. And then in BC, we have another team. And in Nevada, we have another team. And then we have a team in India and South America. So let's say there's about 60, 70 people all together involved in this project. How are you going to, keep the lights on for everybody? And it's not an easy topic to have, because you recognize that you're going to come out with something that is going to improve people's lives, but not everybody's going to be able to afford it. And it doesn't sit well, mm-hmm. And that's really how I feel inside. But on the counterbalance to that, I'm going to be very honest with you guys. My chairman, he challenges me every day to say, well, how are you going to get governments to accept this? Right. So he's challenged me to think about not just individual clients, but countries accepting technology, because he thinks that this should be available to everybody as well. Mm-hmm. And I think from a physician's point of view, if you find yourself, in the entrepreneurial world where, I do it because honestly, I think the experiences you get as an entrepreneur are so varied that every day is a new adventure. That's really why I do it. Every day is a new. I have no idea who I'm going to be dealing with, what topic I'm going to be dealing with, whatever.
It's so true.
But sorry to interrupt. I feel like we are at a time we need to work on the open Q&A. I do want to bring two doctors maybe back to the stage, and we have a lot of questions on the chat. So I just want to make sure we have time to go over that. So, the question master is going to be Kashif, if you don't mind. You will have the liberty of selecting question of your liking, and you can either answer the question or you pass down the question to other doctors.
Such power. Someone needs to unmute.
We need to
him.
unmute Kashif. And I just want to check if
Okay,
Dr.
perfect.
Cam's still here as well, and then maybe be ready to unmute him as well.
So,
Okay.
round robin question.
Let's try our best.
All right, what was the question?
So you actually have a liberty to select question from the list. There's actually a lot of questions, and I think JP Lam contribute a lot of question here, and we also have pick whatever you like.
I think there's a question about reducing inequalities, I guess, in access. I think that was the theme of Dr. Sehedev's discussion too. I don't know, the economy is acting really strangely. I think everyone's noticed that now. Like inflation is jumping all over the States. I've noticed my own grocery bill is up 10% in the last month. Like I think
That's
everyone's
crazy.
noticing that wonky things are happening.
Yeah.
But the government needs to do something to help with the basics. Food is going to be a concern. Housing is a huge concern right now. If I have to think of one discussion amongst my peers that everything focuses on is where are we going to live? Where are we going to move? And I think this is not a time when maybe the laissez-faire system is going to work for everybody. There needs to be some directed action on this. So I don't know what form that'll take. Like I'm a big fan of Singapore's housing development board, in which they build a lot of middle-class housing in huge numbers. And I think 70% of the population lives there. There was an article in the Atlantic on a similar system being proposed there. So I think it would be something easy for the government to do. And I think just start from there, start on the basics and work their way out from there, I think.
I would love to know when was the last time a condo building was built in Toronto that's family sized. Like, why are we only giving contracts to 600 square foot, and now they're smaller, 500 square feet are supposed to be 1 bedroom plus a den. How do you fit a family in there? How do you fit two people in 500 square feet? Like, where are people supposed to live? I don't understand.
Okay, I think we have someone raise a hand. Sally, are you able to unmute yourself?
Yes.
Perfect.
Thanks, everyone. This is very insightful discussion we had. So I had some question about the role of the government and the government body and agencies. So especially due to COVID, innovation and digital solutions are rising. So we talk about how digitalization is so behind in this healthcare sector. So in practical speaking, we have seen government doing a lot of projects, a lot of silos projects, pilots, and we know that they're not really scalable due to lack of resources and lack of talents competing with the private sector. And on the other hand, a lot of private healthcare companies, I think I saw in the chat saying that they're taking this opportunity to build much better solution. And because sometimes they're more profit driven, and we see that money sometimes is a motivation to foster these kind of innovations. For example, I worked at telemedicine before, so we see cannabis clinic, methadone clinics, are doing telemedicines really well. But at the same time, that will cause a lot of silos. So I just want to hear your thoughts on the role. What do you think? What's the role of the government and Ontario Health? What's the best way to manage these kind of innovation projects? And what are the key strategic directions of the government in these in this innovation sector? So the few key things that you think they should start. Yeah. Thank you.
That's a great question, Sally. I think there's a debate that happens a lot about centralization versus decentralization.
Mm-mm.
And there's pros and cons to both. The thing about healthcare is that you need regulation, because if you don't have regulation, A, people die. B, we're dealing with very, very kind of private data, right? And then C, there's medications, there's procedures, methadone, drugs, all this stuff. Centralization is very much needed in healthcare. On the counter side, centralization also prevents in my eyes, innovation and the ability to be nimble for change, right? Because when you need to go through, multiple hierarchies to get, a check mark that you can paint your walls blue instead of green, it really slows down your ability to move. So I think one topic that they really need to look at is, how do you decentralize a centralized system? And in my mind, every time they try to do something new about changing the centralized, they just centralize even more. Even if they're trying to decentralize, it just becomes more centralized. I think that the second kind of initiative for them to look at is that they need to be KPIs around digitization. So they need to be putting the onus on clinics and then supporting them to be able to move forward with the times. Because, we should not be looking at having a virtual platform for people who are immobile or can't get into clinic as a choice. That should be a requirement for clinics who deal with patients. But the government needs to support clinics to be able to offer that service, because clinics are small businesses. So their costs are real as well. So I think it's a combination, and I'm curious to see what everyone else has to say.
Okay, so we have people raise hands here. I just want to make sure I get it right. So we have Jure Ali. Maybe you can unmute too. I'm just gonna try to do this. Okay.
Hey, how's it going?
Hey, there is.
So a little about myself. My background is in healthcare. I worked at a hospital not too long ago. And, with the mind of analytics, I've seen a lot of potential in the data that healthcare has. Right. I even tried to work with one of the medical physicists where they were trying to, understand the correlation between a person's organ and the dosage that is required for that person.
Right.
But there has been so much pushback that I felt in that environment.
Yeah.
It turned me off that I don't want to work at a healthcare sector from a government perspective.
Yeah.
Or in a way come from a private perspective and provide these government bodies with these applications and these services that we can do. So there's such a big disconnect between, the healthcare and being the innovators in healthcare, because there's no room to grow in Canada, in my experience. And I hope you guys can speak on that.
Zeriz, I'm overall, I'm in line with your experience. I mean, my focus as far as technology and healthcare goes hasn't been on the hospital side, because I think it's a losing end in terms of your time and your resources as an individual. My focus has been of what can I do in the community, because I think a lot of the focus that big companies and big dollars put in hospitals, you can have massive changes if you put a fraction of that into the community, right? And the plus side is that you're not dealing with boards in the community, you're dealing with small businesses. So their mindsets are very different, right? I'm with you on the sense that Canada is a limited market to evolve and grow, but it's an important market to test your product, because your ability to gather data in Canada is going to reflect your ability to gather data in other parts of the country, because we have very strict guidelines. We have great ability to gather data if you're able to do so. And then you got to figure out what you do with that data here before you scale outside of Canada. And that's the approach that we've used within our own company.
I think I went to a funding meeting at one of the hospitals I work at to sort of pitch an idea of an AI sort of testing program using Google Voice and the Google Assistant. And basically they said, don't even try to interface with the data in our hospital system. It's going to take 2 years to approve.
Yeah.
So don't even think about it. And then the other side was that, they had just survived a ransomware attack.
Yeah.
So ultra paranoid. So it's really hard to get it. And, look at the Israelis, right? They were able to market their access to data, health data, to all of the vaccine companies and had early access to all of the top vaccine candidates because they could hand all the vaccination data on a platter to the companies. We could have done that. Ontario could have done that. We can access it. It's just no one thought to do it, and no one's really made it easy to do. So, yeah, I completely agree with you, Amrit, that this is such a huge wasted opportunity that we need to work on. And it would be nice if we could validate products in our hospitals.
Yeah, honestly, like I've always wanted to work at a hospital before it was as a doctor, but because it cost so much money, didn't have the luxury. So I was like, let's go from a different route. But I really want to work, help people work at a hospital, but it's just so difficult when like all the senior management team have this very tunnel vision on what they want to do. Because the concept is we got to have the lights on and that's all that matters.
I think if I just, because this is such an important topic, because this is the first problem that every entrepreneur in healthcare faces. It's the first mistake every entrepreneur faces, which is, Zers, when you're looking at your business problem that you're trying to solve, I would challenge people not to think about it from the hospital's perspective, but from a patient's perspective, right? Because the hospital is always going to be a barrier, but the entity that you should be designing something for should be your end user. And you need to take the hospital out of that equation. That's been, and again, I say that I don't think there's any right answer here. I'm just talking about from my own experience.
Well, thank you for your comments. I appreciate that.
So next, I'm gonna passing down the mic to Jeremy. I know you're having patiently waiting.
Yeah, no, thanks. So as a preamble, I don't have a formal healthcare background. I have an investing background, but I just can't help but ask you guys these questions because I've been looking at the evolution of the U.S. healthcare sector, and one big movement there is value-based healthcare, and I'm seeing so many startups, One Medical, Oak Street Health, all over the United States, and they're taking the cue from the policymakers that, hey, the old way of volume-based primary care, or they want to upend that. They want quality-based incentives. So is that a possibility here in Canada? And if so, what do you think needs to happen for the policymakers to really unleash the potential of the private sector? Or do we just wait for the next election? Is there anything we can do? Like who can we look out to for? Yeah.
Kashif, do you want to? I have some thoughts, but I feel like I've been hogging the questions.
Yeah, quality metrics are hard, especially since a lot of, like Amrit was saying, like a lot of the clinic work is not documented on electronic systems yet.
Oh.
It would be hard to measure, and things in healthcare are really hard to measure too. Like, what is quality? Is the doctor who sends people home faster quality? Is it someone who doesn't miss things quality? I think the implementation in the US, I haven't been following it closely, but I think if you look at Medicaid and Medicare, a lot of the ways that have been implemented have led to their own troubles. So I think it's a complicated discussion. I don't think it's going to be solved here in Canada.
Yeah, I'll add to that it's a great question, but the reality is that the US and Canada are completely different beasts. The US is backed by industries whose goals and like their stakeholders, like insurance companies, are looking for reduced premiums. But very smartly, what these companies have acknowledged is that they need to use technology to reduce premiums while delivering excellent care that are measured by KPIs, right?
Yeah.
So the thing, and I hate to say this, the thing that like they've connected is the resources part that we haven't connected, mainly because we're such a smaller country, right? And I think like resources play a huge role. I don't think we lack the technical innovation to do so. I think we could easily play that role, but because success is deemed differently in the US, Canada has been and will always be a step behind.
Okay, great, thanks.
I think we might need to wrap this up. Right now it's at 7:30. I just want to give a thank you to all speaker here, and it's quite an insightful section, and I personally learned a lot. And just also wanted to let people know we're giving out this survey. I think there's a link on the chat, so if you don't mind filling it out, we're also going to send a link to all participants. And for all the job seekers / hiring manager, if you're interested to leverage some of our platform, so we have this online community, especially we had this for COVID, just we realized a lot of people are probably looking for a new opportunity during this time. And it would be lovely to see you guys there. We also strengthen the community by having a Discord. So it is brand new community, and I think all the doctors are already there. If anyone would like to continue the discussion, and I know 1.5 hours is not going to be enough to cover everything on healthcare and the future of the revolution. So please stay tuned and follow us on A Little by Design or ABD Toronto. And thank you so much, everyone, for attending. We will end here.
Thank you, everybody.
Thank you,
Thanks,
everyone.
guys. Going forward.
Everyone.
Thanks.
Bye.
Bye.